Welcome back to Bloomberg West. I'm Emily Chang. We turn back now to our Wiring the World series. This week we are looking at how tech is shaping the future of healthcare. Hospitals are turning to wearable tech to improve nursing efficiency and boost patient satisfaction. Nurses at Florida Hospital Celebration Health wear small tracking devices called radio frequency ID tags. The hospital uses big data software to follow these trackers and create a map of where nurses traveled throughout their assigned hospital unit. I sat down with Celebration Health's Performance Improvement Director, Ashley Stimmons, and started by asking her why the hospital decided to implement this tracking system.
There was nothing automated or any way to truly understand what was happening with our care team throughout their shifts to really look at that workflow pattern and how that correlated to the outcomes and the experience our patients were having. So we added this technology to figure out how do we best leverage our resources with our care team to meet the needs of our patients, since everything is changing and now it's really doing more with less and going to a quality and experience-based healthcare industry versus volume. We need to understand how to best leverage our resources. And so that's really what we were looking to do with this, and to understand that workflow in a way that we haven't been able to in the past.
How big a problem were you having with patient wait times, and how much time has this saved?
It wasn't so much about the wait times. In our ER, we've actually made, in the emergency department, we've actually made tremendous improvement in terms of wait times there, where we typically average less than 30 minutes to see a doc in our emergency department. It was more used on the inpatient side once you're admitted to the hospital to understand what's happening to you during that length of stay, and those value add points where you actually have a caregiver actually spending time with you throughout that 3-day stay or whatever that length of stay is.
How did you design and choose the software that's helping you do this?
Well, we looked at a few different companies, and really when we started to narrow down who we would want to partner with in this, we needed to know that, one, they would be agile and willing to innovate the technology and interface with all of the other technologies existing in our healthcare space. And so we ended up choosing Stanley Healthcare's real-time location system based on those principles and the platform that they have as a software solution that allows us to truly integrate the data from other points to really have a robust resource of data to do analysis from.
And what's the cost?
The cost is, it's not as heavy as you would think. Overall, their solution is based typically on the license, so you pay a license fee annually, and then you have however many users of that license fee that you choose. So it's not an exorbitant cost, and it's really just about the setup around it and managing it is where you have to look at resources that you want to allocate as an organization to actually day-to-day manage the function of the system versus just purchasing the license.
What have you changed as a result from the information you've gathered from this and what you've learned?
So ideally, what we've been able to try to understand and learn is, what is that best practice workflow of the care team? What does that look like on a 12-hour shift or a 3-day period of 3 shifts? What is that right mix of time with the patient, time charting, the other things that we know the care team has to do? What does that look like in terms of getting us the experience and outcomes we want our patients to have? Because we know as healthcare is moving forward more towards outcomes and experience, we can't stay tied to the measures we've used in the past to dictate how we staff our units. And so with this information, we're learning that those old school measures are no longer relevant. We need to understand the time by individual patient that our care team is spending with them as they're with us, so that we can truly prepare them and care for their whole person before they leave us and continue their health journey at home.
Do you see any other opportunities to apply this kind of technology to medicines, other parts of the industry?
Oh, absolutely. I think it's relevant throughout the industry because it gives you a real-time visibility into all of your resources throughout the hospital, really, or even any industry. And it's been in other industries for a long time. It's just now really being innovated in healthcare. And so it's relevant in, tracking regular beds, pumps, equipment of that nature, and tracking people. We're also, we've moved last year, I believe it was, to tracking patients as well, so that we can understand those touch points with the patient along their care journey.
That was Ashley Stimmons, Director of Performance Improvement at Celebration Health.